Hi, happy Tuesday afternoon, everybody out in Facebook land. I have a very timely topic that I want to talk about today. This is from Sunday's newspaper, the Houston Chronicle, in the Zest section. Hope you can see that. Medical cannabis, the frustrating out of reach for a local family. So I'm just going to read part of this article. It's very heartbreaking. It's very frustrating. Let me just start this here. So it says Micah Jensen of League City, which is just a neighbor of Houston, has autism and a form of epilepsy that doesn't qualify for medical cannabis under the Texas program, because there are some things available now from the Texas program. Micah Jensen reached across the table and slapped his sister's wrist. He shimmied out of his chair, ran up to her face and spit, grabbed his iPad and one of the rubber protectors and chucked it at the wall. He lunged headfirst in the sofa and howled. At least this time, no chairs were thrown. At least this time, it wasn't in public. This time, his sister wouldn't bruise. The 12-year-old's autism makes him easily agitated. On top of that, he has epilepsy, and the medicine he takes to reduce his violent seizures heightens his sensitivity to sounds, including certain words, plunging into an increasingly aggressive cycle. Says there are an estimated 500,000 Texans have epilepsy. 500,000, that's 500,000. But the cannabis law restricts its use to those suffering from a rare, intractable form. In other states, medical cannabis is approved for epilepsy, for autism, for multiple sclerosis, cancer, post-traumatic stress disorder, Alzheimer's disease, and in Texas, only 0.5% of THC can be legally present in the medicine, while in other states there's no cap. Why is it different from state to state? That doesn't make any sense to me. Micah's mom said he was beautiful when he was born. He was perfect. But when Micah turned 3, he began lining up his toy cars in a row and just staring at them. His limited vocabulary became more limited. He forgot how to go potty. She quit her job so she could stay home and take care of him and homeschool him. In old videos, young Micah laughs along with other children while playing musical chairs in therapy. His mom can't watch those without sniffling. That's what was like before August 1st, 2013. Early that morning, she felt something shudder in her bed. Beside her, Micah trembled uncontrollably, and she saw his skin turn a deep shade of blue and purple. He grasped for air. After the epilepsy diagnosis, he used fewer words. He slapped the back of one hand and the palm of the other more often, a go-to sensory stimulation related to autism. He became more easily agitated and even more violent, especially in hearing certain words. Certain words would trigger his aggression. It's not a response he can control, his mom says. The older he gets, the stronger his attacks. Desperate for something that could address both his epilepsy and his autism, she's researching possible solutions. And these are just some pictures of him. Okay. This is heartbreaking. What if this was your child, or your brother, or your sister, or your grandchild? And the sad thing is there's help available. But cannabis is very hard to get a hold of. It's not easy. Hi, Dr. Patrick. Thanks for joining. So this cannabis, which is sourced from marijuana, is very restricted. Who restricts it? Guess who holds the patent? The patent on cannabinoids. I hope you can read this. United States patent. The government has control over this drug that could give some relief to this poor family and hundreds of thousands of other families, but it's not available. They listed the patent as an antioxidant and neuroprotectant. So it lowers the oxidation process in the body and it protects the nerve supply. That's what their patent says, and yet these families can't get it. It's not available for them. Just a quick Google search on the benefits of cannabis. Here's a short list, all right? The short list is it can help you lose weight. It can regulate and prevent diabetes. It helps fight cancer. Fight cancer. The number 2 killer in the United States, cancer. It can help with depression. It shows promise against treating autism. It's a safe alternative to drugs and alcohol. It helps to regulate seizures. This boy has autism and seizures, and they can't get this stuff. It helps broken bones heal faster. It helps with the treatment of ADHD. It can help treat serious addictions. It helps treat glaucoma. It can improve lung function. It helps with anxiety. Do you know how many deaths there are from cannabis? Do you know how many deaths there are from these other medications that are available that are treating these things? So I want to let you know, at the Wellness Way, my approach is not just to treat a symptom. Our motto is we don't guess, we test. So what happened? This child was a fine, healthy, developing young child until 3 years old. What happened? Something flipped. So what triggers that? Why are we seeing more and more of this? This is just very infuriating. And to have these things that are available can help these children, and not have it available is criminal. Hi, Patty. Thanks for joining. We have a short list because we do not have the cannabis oil because it's not legal in Texas. However, we do have a CBD oil that's sourced from the hemp plant, and that is legal in Texas. And so some of our patients that have been taking the hemp plant, hi, Becky, thanks for joining. Here's some of the benefits that we're hearing back from our patients, all right? Hi, Ross, thanks for joining. CBD oil benefits. These are the benefits reported from our patients. One male patient reported his wife was using on her face for her wrinkles. After 3 weeks, she looks 20 years younger. Okay, that's not so great. I mean, it's great, but more importantly, one of our patients reports the management of their migraines, where normally they get the aura, it prevents it from escalating into a severe migraine. 2 doses managed her pain and are within an hour of taking the CBD oil. One patient reports relief of severe menstrual cramps that were intractable and escalating over hours. 2 doses within an hour relieved her pain. This stuff is amazing. Why is it not available? One patient reports complete management of anxiety, severe stress anxiety to where it rocks her world, unmanaged by Xanax and clozapam. She's taken those, but it totally takes her away, disengaging her from her world. So she takes those, but then she's a zombie and she can't function, and she's a mom and she's got small children. Another patient reports relief from the pressure of head caused by encephalopathy. How do I say it, Amy? Encephalopathy. There we go. More effective than hydrocodone. Hasn't taken it in 3 months. She hasn't had to take hydrocodone in 3 months because of the CBD oil. This stuff is amazing. Hi, Ashlyn. Thanks for joining us. So like I said, the Wellness Way, we don't guess, we test. We know that there's tremendous benefits from the CBD oil. Again, we have it available in our office. When we can, it's back ordered right now because it just flies off the shelf. As soon as it comes in, it's out again. So we're out right now, and we can't even get it on our shelves right now because it's back ordered. This stuff is amazing, and we have it available as soon as it's back ordered. But besides that, what else is going on? Does that child have some food allergies that if we could discover those and remove those and pull those triggers out, could that calm down the aggression that he's feeling, the inflammation that he has in his body? Yes. What about, let's check some neurotransmitters and see what's going on with that. Hi, Annie. Thanks for joining. Hi, Brandon. Nice to see you. Thanks for joining. So we want to test and see what else can we do to help these individuals work better. When I look at this child, let me grab this one more time. When I look at this family story, it's not just this poor child. Poor child severely affects his life. He'll never be normal. But not only that, it affects his whole family. It affects his sister, his mom. His mom had to quit work so she could stay home and take care of him. And what happens? Autism, this is on such a rise right now. What happens in 20 years from now when these kids can't take care of themselves? How are we gonna take care of them? How are we gonna provide for them? Because the number is growing year by year. What are we gonna do? Hi, Nancy. Thanks for joining. This is very serious. There's more I want to say on this subject, more than I can cover today. So I'm going to have a part 2. We're going to talk about this medical cannabis. It's good stuff, and why it's not available, it's criminal. The U.S. government holds the patent on it, and they're not making it available, and it's criminal. These people could have relief. They could have some help. Is it going to cure the child? No. Could it give them some relief? Absolutely. So, but only a certain percentage in Texas can only have a small dose of this. It breaks my heart, and it's so unnecessary. Okay. So with that said, we don't guess, we test. If you're having some issues with your health, I'd be happy to test you and see what's going on. Even if we only test food allergies, if we could just find your food allergies and remove those, like we do for so many of our patients, just doing that one thing and removing those triggers and healing the gut, we can see tremendous benefits, tremendous health benefits from that. Even tremendous psychological benefits and how it helps with your anxiety and helps with all the different systems in your body. At the Wellness Way, we talk about the body as like a Swiss watch. All of these gears interact. So if we can calm down one of the gears, it helps bring all the gears down so that you can have a better quality of life. This child's life is never going to be the same, but if we could do something to give a little improvement in the quality of his life, not only will it affect that child, but the trickle down effect to his family and to the people that care for him, to when he take him out in public. So this stuff is big. A disease doesn't just affect one, it affects many. That's why it takes a village. Absolutely, Annie. And this type of a situation where it's a child and they're aggressive and they can't control themselves, it's huge. And it has over accumulating effects, you know. And so please join me next week because I have more that I want to say about this topic. But in the meantime, get tested. If there's anything we can do to reduce that inflammation, that aggression, and there are things that can be done. That's the criminal thing. There are many things that can be done. I can't do the legal marijuana, but I've got some CBD, and there's other testing, and we have other medicinal herbs that have a calming effect on inflammation in the body. If we can remove these triggers that are causing these things to spur up and to flame up, it's got to help the quality of life, you know. So, and we're seeing that day in and day out, not only in our office here in Houston and Memorial, but across the United States with the other Wellness Way offices. I think there's over 50 offices now. So twwclinics.com, if you want to find us online, you can get information there. If you're here in the Houston area, I'm happy to take care of you. I'm happy to have a consultation with you, see what's going on, if there's anything we can help you with. We're here. That's what we're here for, to help you. So we were at a talk last night, and I'm going to wrap it up. We're going to go see some teachers tomorrow and show them some appreciation. Thank you to all of our teachers, the Teacher Appreciation Week. You're the most underappreciated profession out there. Not unappreciated, just underappreciated. We appreciate you. You're educating our kids, our future, our generation for tomorrow. So thank you so much to our teachers for all that you do. Next week, I'm going to talk some more about cannabis. So join me next week because there's a lot going on. This is a very timely topic in the States right now. So please join me next week. Thank you for joining me today. Please like and share this video so this information can get out to more people. So thank you so much. I look forward to seeing you next week. Have a great afternoon. Wow, I had some people joining me today. I'm so excited. Yeah. Woo-oo.
And it was a great talk.
Okay. Did I just ramble or was it?
No.